Most people think a swollen knee is just a minor injury or a normal part of aging, but in some cases, it can be your body's urgent warning that a serious infection is developing. Ignoring these early signs could lead to permanent joint damage or even life-threatening complications. In this video, we'll explore 7 warning signs you should never ignore, the science behind them, and when it's time to seek medical care. Most people assume that a swollen knee is simply the result of a minor injury, overuse, or the natural aging process. After all, many of us have experienced knee discomfort after a long walk, a workout, or an awkward twist while climbing stairs. In many cases, that assumption is correct. The body's inflammatory response is a normal part of healing, helping repair damaged tissues and restore function. However, there are situations where swelling is not just a sign of healing, but a warning that something much more serious is happening beneath the surface. One of the most concerning possibilities is an infection inside or around the knee joint. Although it is less common than other causes of knee pain, a joint infection is considered a medical emergency because delaying treatment can result in permanent damage to cartilage, loss of joint function, and, in severe cases, the infection spreading throughout the body. To understand why this happens, it's helpful to know what inflammation actually is. Inflammation is your immune system's natural defense mechanism. When tissues are injured or invaded by harmful microorganisms such as bacteria, your immune system sends specialized cells, proteins, and signaling molecules to the affected area. This process increases blood flow, causing redness and warmth, while extra fluid enters the tissues, leading to swelling. The purpose of this response is to isolate the problem, destroy harmful invaders, and begin repairing damaged tissue. When inflammation is caused by a simple injury, it usually follows a predictable pattern. Swelling gradually improves over several days with rest, ice, compression, elevation, and time. Pain also begins to decrease as healing progresses. An infected knee behaves differently. Instead of gradually improving, symptoms often become worse over a relatively short period. Harmful bacteria can enter the knee through a cut, scrape, surgical incision, injection, or by traveling through the bloodstream from another infection elsewhere in the body. Once bacteria reach the joint space, they can multiply rapidly because the environment inside the joint provides nutrients while limiting the body's ability to eliminate the infection quickly. As bacteria grow, the immune system launches an aggressive response, producing even more inflammation. Unfortunately, while this immune response is intended to fight the infection, it can also damage the cartilage that cushions the bones inside the knee. Healthy cartilage has very little ability to repair itself once damaged. If bacteria and inflammatory chemicals remain inside the joint for too long, they can begin destroying cartilage within days. This is why doctors treat suspected joint infections with urgency. Early diagnosis and treatment dramatically reduce the risk of permanent damage and improve long-term recovery. It's also important to recognize that not every swollen knee means there is an infection. Many common conditions can cause swelling without involving bacteria. Osteoarthritis, which becomes more common with age, causes gradual wear and tear of cartilage, leading to stiffness and swelling that often develops slowly over months or years. Rheumatoid arthritis is an autoimmune condition where the immune system mistakenly attacks healthy joints, producing chronic inflammation without any infection. Gout occurs when uric acid crystals accumulate inside the joint, triggering sudden episodes of severe pain and swelling. Sports injuries, torn ligaments, meniscus tears, and repetitive strain can also produce significant swelling without any infectious cause. Because these conditions share some overlapping symptoms, it can be difficult to determine the exact cause based on swelling alone. That's why paying attention to the overall pattern of symptoms is so important. An infected knee often progresses rapidly rather than gradually. Pain may become severe even without significant movement. The joint may feel unusually warm compared to the surrounding skin, and swelling may continue increasing instead of stabilizing. These differences provide valuable clues that something more serious may be occurring. One of the earliest warning signs that deserves attention is pain that seems far more intense than expected. Minor injuries usually improve with rest, but infection-related pain often continues to worsen despite avoiding activity. Some people describe the pain as deep, constant, and throbbing. Even light pressure on the knee may become extremely uncomfortable. Walking may become increasingly difficult, and simple movements such as bending or straightening the knee can feel nearly impossible. Another important early sign is warmth around the knee. During infection, increased blood flow and immune activity generate noticeable heat. If one knee feels significantly warmer than the other, particularly when accompanied by increasing pain and swelling, it should not be ignored. Warmth alone does not confirm an infection, but when combined with other symptoms, it becomes a meaningful warning signal that requires medical evaluation. Redness is another clue. As blood vessels expand to allow more immune cells into the affected area, the skin over the knee may become red or flushed. In some cases, the redness spreads beyond the joint itself. This combination of swelling, warmth, redness, and worsening pain is often much more concerning than swelling alone. A rapid increase in swelling is equally important. Normal swelling after exercise or a mild injury generally peaks within the first day or two and then slowly improves. In contrast, an infected knee may continue swelling hour after hour or day after day. The joint can become so filled with inflammatory fluid that bending the knee becomes difficult, and the skin may appear tight and shiny. Loss of range of motion is another early warning sign. As pressure builds inside the joint, movement becomes restricted. Some people find they cannot fully straighten or bend the knee without intense discomfort. This stiffness isn't simply due to soreness. It often reflects increasing inflammation within the joint itself. When pain, warmth, redness, worsening swelling, and reduced movement begin appearing together, they create a pattern that should never be dismissed as a routine strain or a normal part of aging. Prompt medical evaluation can identify the underlying cause and, if an infection is present, allow treatment before irreversible joint damage occurs. As a knee infection progresses, the body often begins sending stronger warning signals that the problem is no longer limited to the joint itself. While the earliest symptoms may include pain, swelling, warmth, and redness, more advanced signs can indicate that the infection is becoming increasingly serious. Recognizing these symptoms early is critical because delaying treatment may allow bacteria to spread beyond the knee and affect other parts of the body. One of the most important signs to watch for is the development of a fever. A fever is the immune system's way of responding to an infection by raising the body's temperature to create an environment that is less favorable for bacteria. Although not everyone with a joint infection develops a high fever, especially older adults or people with weakened immune systems, even a mild temperature increase accompanied by a swollen, painful knee should never be ignored. Along with fever, many people experience chills. Chills occur when the body rapidly contracts and relaxes muscles to generate heat, often making a person feel cold, even in a warm room. This combination of fever and chills can be a sign that the immune system is working hard to fight an active infection. Fatigue is another symptom that commonly develops as the infection progresses. Instead of feeling refreshed after rest, individuals may notice overwhelming tiredness, weakness, and a lack of energy throughout the day. This happens because the immune system requires significant energy to produce immune cells and inflammatory proteins, leaving fewer resources available for normal daily activities. Some people also lose their appetite or experience general feelings of illness, similar to having the flu. These symptoms may seem unrelated to the knee at first, but they often reflect the body's widespread response to infection. When these systemic symptoms occur alongside a swollen, warm, and painful knee, they deserve prompt medical evaluation rather than waiting to see if they improve on their own. One of the clearest signs of a serious infection is the presence of pus or abnormal fluid draining from the knee. Pus is a thick fluid made up of dead white blood cells, bacteria, damaged tissue, and proteins produced during the immune response. Its appearance usually indicates that the body is actively fighting a bacterial infection. If pus is seen coming from a wound, surgical incision, or opening near the knee, medical attention should be sought immediately. Even if there is no visible drainage, doctors may discover infected fluid inside the joint through imaging studies or by using a sterile needle to remove a small sample of joint fluid for laboratory testing. The color and appearance of drainage can also provide useful clues. Clear fluid after a minor injury is often part of normal healing, but thick yellow, green, or cloudy fluid is much more concerning for infection. An unpleasant odor from the drainage may further increase suspicion, although not every infection produces a noticeable smell. If a joint infection is left untreated, bacteria can sometimes enter the bloodstream, leading to a potentially life-threatening condition known as sepsis. During sepsis, the body's immune response becomes widespread and can begin damaging healthy tissues and organs. Early symptoms of sepsis may include high fever or unusually low body temperature, rapid heart rate, fast breathing, confusion, dizziness, and extreme weakness. While sepsis is relatively uncommon, it represents one of the most serious complications of an untreated joint infection and requires emergency medical care. Fortunately, recognizing the warning signs early greatly improves the chances of successful treatment. This is why it is important not to dismiss symptoms like fever, chills, fatigue, or drainage as unrelated problems, especially when they occur together with worsening knee pain and swelling. Certain individuals are more likely than others to develop a knee infection. One of the strongest risk factors is older age. As people grow older, the immune system naturally becomes less efficient, making it more difficult to fight invading bacteria. At the same time, age-related joint problems such as osteoarthritis often increase the likelihood of knee procedures, injections, or surgeries, each of which may slightly increase the risk of infection if bacteria enter the joint. People living with diabetes also face a higher risk. Elevated blood sugar levels can interfere with the normal function of white blood cells, making infections more difficult to control. Diabetes may also reduce blood circulation, slowing the delivery of immune cells and nutrients needed for healing. In addition, nerve damage caused by diabetes can sometimes reduce sensation, making it harder to notice cuts, wounds, or early signs of infection before they become more serious. Individuals with weakened immune systems are another high-risk group. This includes people receiving chemotherapy, those taking medications that suppress the immune system after organ transplantation, individuals using long-term corticosteroids, and people with certain autoimmune diseases who require immune-suppressing treatments. Because their immune defenses are reduced, infections may develop more easily and progress more rapidly than they would in otherwise healthy individuals. Recent knee surgery is another important risk factor. Although modern surgical techniques use strict sterile procedures and postoperative antibiotics when appropriate, no surgery is entirely free of infection risk. Bacteria can occasionally enter during or after the procedure, making careful wound care and close monitoring essential during recovery. Increasing pain, redness, swelling, fever, or drainage after knee surgery should always be reported to a healthcare provider without delay. People who have recently received knee injections also have a small but important risk. While injections are generally safe when performed under sterile conditions, any procedure involving a needle entering the joint carries a very low possibility of introducing bacteria. This risk remains uncommon, but is important to recognize if symptoms rapidly worsen following an injection. Open wounds, cuts, abrasions, or animal bites near the knee can also provide bacteria with a direct pathway into deeper tissues. Even injuries that appear minor on the surface should be cleaned thoroughly and monitored carefully, particularly if redness, swelling, or increasing pain develops over the following days. Finally, individuals with artificial knee joints require special attention. Although joint replacement surgery is highly successful for relieving pain and restoring mobility, bacteria can sometimes attach to the surface of an implanted joint, making infections more difficult to eliminate. These infections often require specialized treatment and, in some cases, additional surgery. Understanding these risk factors helps people recognize when knee symptoms deserve immediate medical evaluation rather than assuming they are simply part of aging, exercise, or a routine injury. Early recognition remains one of the most effective ways to protect both joint health and overall well-being. Ignoring a possible knee infection can have serious consequences because bacteria inside a joint can multiply quickly and damage tissues that have very little ability to repair themselves. Unlike muscles or skin, the smooth cartilage that covers the ends of the bones inside the knee has a very limited blood supply. This means that once cartilage is injured or destroyed, the body cannot easily replace it. During a bacterial joint infection, both the bacteria and the body's immune response release enzymes and inflammatory chemicals that begin breaking down this protective cartilage. Research has shown that significant joint damage can occur within a matter of days if a true joint infection is left untreated. This is why healthcare professionals consider a suspected infected joint a medical emergency rather than something that should simply be monitored at home. As cartilage deteriorates, the bones inside the knee lose their smooth protective surface. This increases friction every time the joint moves, leading to worsening pain, stiffness, and reduced mobility. Even after the infection has been successfully treated, permanent cartilage loss can leave a person with chronic pain, arthritis, or long-term difficulty walking. In severe cases, irreversible damage may eventually require knee replacement surgery to restore function. The infection can also spread beyond the cartilage into nearby structures. Ligaments, tendons, surrounding muscles, and soft tissues may become involved, making recovery more difficult. If bacteria invade the bone itself, a condition called osteomyelitis can develop, Bone infections often require weeks of antibiotics and, in some cases, surgery to remove infected tissue. Because bone has a complex structure and relatively limited blood flow in certain areas, these infections can be especially challenging to treat. One of the greatest dangers occurs when bacteria escape the infected joint and enter the bloodstream. Once bacteria begin circulating through the body, they may travel to distant organs, including the heart, lungs, kidneys, or brain. The immune system responds aggressively, but sometimes this response becomes widespread and uncontrolled, resulting in a condition known as sepsis. Sepsis is a life-threatening medical emergency that can cause dangerously low blood pressure, reduced blood flow to vital organs, confusion, difficulty breathing, and organ failure if not treated promptly. Although not every knee infection progresses to sepsis, recognizing the possibility highlights why early diagnosis is so important. Waiting several days to see whether symptoms improve may allow the infection to become much more difficult to control. People sometimes delay seeking care because they believe the swelling resulted from exercise, aging, or a minor injury. Others may attempt to manage symptoms using only over-the-counter pain relievers. While these medications may temporarily reduce discomfort or fever, they do not eliminate bacteria causing an infection. Masking symptoms without treating the underlying cause can allow the infection to continue progressing unnoticed. Another potential complication is the formation of abscesses, which are collections of pus surrounded by inflamed tissue. Abscesses often require drainage because antibiotics alone may not fully penetrate the infected pocket. If left untreated, these collections can continue growing, increasing pressure within the tissues and causing further destruction. For individuals with artificial knee joints, infections present an additional challenge. Bacteria can attach to the surface of implanted materials and form protective structures called biofilms. These biofilms make bacteria much harder to eliminate because they shield the organisms from both antibiotics and the immune system. In some cases, treating these infections may require removing and replacing the artificial joint, followed by prolonged antibiotic therapy. Fortunately, the outlook is much better when treatment begins early. Prompt medical care can often stop the infection before irreversible damage occurs, preserving both joint function and overall health. This is why recognizing warning signs and acting quickly can make a tremendous difference in recovery. If you experience rapidly worsening knee pain, swelling, warmth, redness, fever, chills, or drainage, it is important to seek medical evaluation as soon as possible. Rather than attempting to diagnose the condition yourself, allow a healthcare professional to determine the underlying cause. Many conditions can produce similar symptoms, including gout, rheumatoid arthritis, bursitis, ligament injuries, and other inflammatory disorders. Because these problems require different treatments, obtaining an accurate diagnosis is essential. During the medical evaluation, your healthcare provider will begin by asking about your symptoms, recent injuries, surgeries, injections, travel, illnesses, and medical history. They will examine the knee carefully, looking for swelling, redness, warmth, tenderness, and reduced range of motion. They may also compare both knees to identify differences in appearance or temperature. Blood tests are often performed to look for signs of inflammation and infection. Doctors may measure markers, such as white blood cell count, C-reactive protein, and erythrocyte sedimentation rate. While these tests cannot confirm a joint infection by themselves, they provide important clues when interpreted alongside symptoms and the physical examination. One of the most valuable diagnostic procedures is joint aspiration, sometimes called arthrocentesis. During this procedure, a healthcare professional uses a sterile needle to remove a small sample of fluid from inside the knee joint. The fluid is then examined in a laboratory for bacteria, white blood cells, and crystals that might indicate gout rather than infection. Identifying the specific bacteria responsible also helps doctors choose the most effective antibiotic treatment. Imaging studies such as X-rays, ultrasound, or MRI scans may also be recommended. Although X-rays primarily show bones, they can help rule out fractures or identify chronic joint changes. Ultrasound can detect fluid collections within the joint, while MRI provides detailed images of cartilage, ligaments, tendons, and surrounding soft tissues, helping doctors evaluate the extent of inflammation or damage. If a bacterial joint infection is confirmed or strongly suspected, treatment usually begins immediately. Intravenous antibiotics are commonly started before laboratory cultures are finalized if the infection appears severe. Once culture results identify the specific bacteria, antibiotics can be adjusted to target the organism more precisely. In many cases, excess infected fluid must also be removed from the joint through repeated aspiration or surgical drainage to reduce pressure and improve antibiotic effectiveness. Recovery often includes physical therapy after the infection has been controlled. Gentle exercises help restore strength, flexibility, and normal movement while minimizing stiffness that can develop after prolonged inflammation. Following the healthcare team's recommendations regarding medication, rehabilitation, and follow-up appointments plays an important role in achieving the best possible outcome. The key message is simple. Persistent or rapidly worsening knee swelling should never be ignored, especially when accompanied by warmth, redness, severe pain, fever, chills, or drainage. Most swollen knees are not caused by serious infections, but recognizing the warning signs and seeking timely medical care when they occur can prevent permanent joint damage and protect your overall health. Early action gives both the immune system and modern medical treatment the best opportunity to stop an infection before it causes lasting harm.